Again, Dr. Sherik is going to do the role player in the doctor's role in a station in which the doctor is going to do a mental state examination for a young patient around the age of 20s because he attacked his stepbrother and smashed his laptop, believing that he is taking his thoughts by the laptop. And while doing so, he injured his hand. He was taken to the emergency room, and after taking care of the wound in the hand, you are supposed to do a mental state examination for the patient. Now, as you can see in the story, there is some issue concerning the safety and risk. Pay attention to the risk assessment. Other than this, just also show some empathy and try to ask him how his hand is doing now, and if he has any complaint, that's it. Because if someone is coming to you with a new injury, definitely show empathy towards this. Now we are going to start now. Let's say that my name is Michael and my stepbrother is John. Okay. My stepbrother is John. And again, in the story, he also believes that his stepbrother is involved in this, and he also has dirty hallucinations. And you are seeing the patient in the ER. 1, 2, 3, go.
Hello, I'm Dr. Sharik. I'm one of the doctors, psychiatrists working here in the mental health unit. You have been referred to us in the ER regarding an incident that took place at your home. Can you tell me more about it?
Yes, doctor. Today I decided to stop what's going on. My stepbrother, Jean, he's taking my thoughts by his laptop and decided to stop this. I smashed his laptop, and while doing so, I injured my hand.
Oh, I'm sorry to hear that. Is your hand okay now?
Yeah, no problem. Did it just
was an X-ray?
Some contusions, that's it.
Okay, was an X-ray done on it? Is it okay?
Yeah, everything is okay.
Okay. So to get the perspective clear, I want to ask you, why do you think your brother is thinking that he's taking your thoughts away?
I don't know. Maybe he wants to be better than me because we are both in the same technical institute. Maybe every time I go to the exam, I find that my mind is blank. There are no ideas in my mind, and then I find all the ideas in his laptop.
Since when did you start feeling this?
Yeah. There is no other explanation.
Okay, sorry, I couldn't hear you. Hello?
There is no other explanation.
Okay. Were there any stresses before this problem started?
No, nothing. Before that, everything was nothing. Before what?
Before this thought started, were there any stresses?
No.
You had been using any drugs or alcohol before this?
No.
Any new medicine that you might have started?
No.
Okay. I think you are very distressed. I want to assure you are in a safe place, and we are here to help you. Could you also tell me about a little more about this thoughts that you are having?
Excuse me?
Could you tell me more about these thoughts that you are having?
I don't have any thoughts, doctor. These are facts. He is taking my thoughts in his laptop, and I asked him several times to stop doing this, and he made fun of me. But today I decided to stop what's going on, and I smashed his laptop.
Are you really convinced about this thing?
Doctor, there is no other explanation. All my thoughts are in his laptop.
Okay, I'm going to ask you some strange questions which you might feel uncomfortable. Do let me know. Are you able to think clearly?
I'm able to think clearly. Yes, yes. I'm able to think
Do you ever
clearly.
feel that? Okay. Did you ever feel that somebody is hampering in a way with your thoughts, trying to take them away,
Yes,
trying to insult?
my stepbrother is uh, is taking my thoughts away.
Okay. Anybody else involved with your stepbrother in doing this?
Yes, my stepfather, because he is the one who bought for him this laptop.
Okay. Ever heard any sounds that somebody else, that nobody else can hear?
Excuse
Voices.
me?
Ever heard any voices that nobody else around you is hearing?
No, no, no voices, but I don't know how, while I'm in my bedroom, I can hear them talking about me. Him and his father, my stepbrother, and my stepfather.
They talk about you. Do they refer you directly?
Yeah, yeah, they are talking about me and talking about taking my thoughts.
Okay. And do they also send you any commands? Have you acted upon them?
No, no, but they comment on what I'm doing.
They keep commenting. Okay. What about any images or visuals?
Excuse me?
Ever seen any visuals or images that nobody else can hear, can see?
No, no,
Okay. Any other bodily sensations like smell or touch disturbance?
no, no.
Okay. What about your mood? How has your mood been for the past couple of weeks?
My mood was not good because I'm angry. They keep taking thoughts from my head.
Are you able to take interest in things that you enjoy currently?
No, because I know that they are taking thoughts of my head, so I don't want, I don't know, but I found that I'm not able to do anything because of them. Maybe because of this laptop, even going to the gym, I cannot do.
Okay. What about your energy levels these days?
Good, they are good. Energy levels.
Any problem in sleep or appetite?
No, no.
Is this problem hampering you in any way, concentrating in your work or studies?
What? 1 minute remaining. What did you say?
Okay. I can see that you're very distressed.
Yes.
Hello? Yeah.
Yes. Yeah.
Ever, how do you cope with it?
I don't. I don't know what to do. They keep. I don't know what to do. I decided to stop what's going on.
Have you been using alcohol or any drugs?
No, no, no,
Ever had any thought about harming yourself or somebody else?
no, no, no,
Has the police been involved in any of the situation?
no.
So, do you think there could be any other explanation to these things that are happening around you?
There is no other explanation.
Maybe that the mind is playing tricks on you.
No, my mind is not playing tricks. I'm sure what's going on.
Okay. So, thank you for talking to me, and it has been
Okay,
wonderful talking to you.
time. So how do you feel about what you did?
Well, yeah, it was a bit.
How do you feel about what you did, Dr. Sharif?
I was thinking in the terms of conduct more.
What?
I was thinking in the terms of conduct disorder more. So I went in that way.
Why are you thinking of in terms of conduct disorder? We said that this is not a history-taking station. Think of in terms of a mental state examination. So I didn't get it at all that you knew exactly when did it all start. Because in psychosis, the duration makes a difference with us.
Yes.
Okay. The
Yes.
schizophrenia diagnosis includes a duration. It differs from DSM-4 and ICD-10, but you must understand that the psychosis makes a difference in the diagnosis if you know the duration. Okay.
Yes.
Number two, when you asked me how did it all, how was there anything before that? Actually, the question was not clear. So you said that anything was there before these thoughts. What is this? You want to know a particular onset and then ask about it.
Yes.
Okay. Again, you entered the area of psychosis in a smooth way, but you were very checklisty while you are asking about the items of the mental state of the psychosis. For example, you said that I'm going to ask you some questions, routine questions, if you would feel uncomfortable and so on. And then, I'm just quoting, are you able to think clearly? No, we don't ask like this. We do something called weaving. You know what is weaving? We bring a bit of the patient's story in our question. How do we say this? Yeah, according to the weaving then. You can say something like, you told me that they are taking your thoughts by the laptop. I'm just wondering that this makes you unable to think clearly? Okay? And go through the other items. Have you ever felt that they are putting thoughts in your mind by the laptop? Or did you have at any time this feeling, even if it is not by the laptop? Okay. What about taking all of your thoughts suddenly? You told me that in the exam, you felt that your mind went out of thoughts. Okay, so you feel that they take all of your thoughts by the laptop. So what I'm saying to you, Dr. Sharik, is that I am putting the patient's story, okay, in my question to make it more palatable. You are very checklist, okay? Anyone is taking, yes, everything. When you were asking about the visual hallucinations, now he already expressed you some perceptual disorder. Take this information and put it in your question. So you told me that you are hearing them while they are not there. I'm just wondering, did you have any other unusual experiences? So
yes.
Have you also saw them while they are not present in the place you are in? Because you also asked a very checklist, have you ever seen? It's not about showing the examiner that you know the items of the mental state examination. It is showing him that you are a professional psychiatrist in assessing the mental state examination. So you pay attention to the weaving, put a bit or a piece of the patient's history or patient's story in your question, okay, to make it more palatable and professional.
Yes.
What about your energy levels? Well, this, you can say it in a very, well, I know that this is present in many of the books and also present in the criteria of depression, but we don't ask it like this. Have you ever felt that you are not able to do things at least required from you? You don't have the energy to do these things? Okay. What about your energy levels? I don't think that it's a very good question. The insight.
Yes.
The insight is not an explanation. The explanation is something related to the, just ask him. So tell me, have you ever felt that, not have you ever felt, tell me more about what you have been experiencing. Do you feel that it could be some tricks played by your mind? Okay. As I said, I try to put in the assessment of the insight, assessing also the past history of contact with psychiatric services. You can start the insight assessment by asking him, I really appreciate being open with me and sharing with me all what you have experienced, but I'm wondering, is it the first time for you to talk to a psychiatrist? If he said no, tell him, so if there is any possibility that what you have been through could be some tricks played by your mind, can be some psychological problem in which we can offer you a great help throughout it. Okay. To sort it out. And if he says, yes, I've been in contact with psychiatric services, tell him any possibility that it could be another episode of so and so. Okay, or ask him if it is why he has been in contact with psychiatric services, and then tell him if there is any possibility that this could be another episode of so and so. So let us see your assessment according to the slides. Again, Dr. Sharik.
Yes.
It's important to understand how to take a complaint, because this is the first thing which you do in the mental state examination. Don't rush to ask about the voices and thought insertion and withdrawal, because in the complaint, you are assessing the main psychopathology. Are you with me, Dr. Sharik?
Yes, sir.
So when you assess the complaint, okay, you must ask about the onset, and then ask him about what happened. What did you do? Why they are doing so? Who else? What is your explanation? Could be there any other explanation? The cause here is not only what increased and increased. Okay, there are other events or other issues in the course. And then asks him about, so you told me that it all started while you are in the exam and you felt that your mind went blank 3 months ago. I'm wondering, how were you doing before that? If he said to you everything was fine, do not insist on asking. Don't be so dogmatic, Dr. Sharik. Yes, I know that there are some items which could be here in this area, but this means that you must ask about them. I'm giving you examples. So if I told you, no, there was nothing before that, everything was good, that's it. Don't insist. So have you been having any street drugs? Did you have any stresses? I told you everything was good. Because if there was anything, definitely the role player will express it to you. He will not hide it, because you already asked about the condition of the patient before the onset. So he must ask, must answer.
Yes.
Okay, so this is for the complaint. You commented on the general because he has injury in his hand, and you paid empathy, showed empathy. There is nothing in the speech. In psychosis, sensitive area to talk about. You also about the perception, but not in a very good way. I didn't feel that you asked about the auditory hallucination in a very clear way. So you asked about two voices inside your head, outside your head. I think you asked if they are giving orders. I told you that they are commenting, but I felt that you could have asked a couple of questions about them. The visual, the area of perception, you asked only about the visual. Did you ask about?
I asked you. Yes.
Yeah. So, but
images and
I remember, but it was very checklist.
Yes.
Persecution, you asked. As I said, this is the acronym or the code which helps me to psychology in depth. Persecution,
yes.
perception, broadcasting, thought insertion, withdrawal, and control. Okay, so broadcasting. Yes. I didn't feel that you asked about the broadcasting, thought insertion, withdrawal. You could have asked these two points in a better way, because I don't know. The story is already about thought insertion and withdrawal. You could have mentioned the laptop to help you to phrase the questions in a better way. The control, likewise. Control is the control of the patient. Likewise, it should be also be asked about while you are mentioning the issue of the laptop. Okay, the mood, you asked about the mood. Okay, cognition, we didn't ask about the cognition. Very important, because he already said that he found that he has some scholastic deterioration. Coping and risk, again, do not be so checklisting. Put pieces of the patient information in your questions, because if you do not do this, you will definitely look or sound checklist. For example, Mr. X, tell me how you are coping. Do you use any street drugs or alcohol? Have you ever had any thoughts of harming yourself? Any thoughts of harming anyone else? Any police charges? This is a typical checklisty way of assessing the patient. You can say so that you have been through a lot of stress because of what you have been experiencing, and I'm wondering how are you coping? Well, tell me, sometimes the youth might use street drugs or alcohol to cope with what they feel. Does this apply to you by any way? You already have been in conflict with your stepbrother. Do you have any thoughts to harm him? Any thoughts to harm your stepbrother? What about harming yourself? Okay, that's it. This is how you ask about anything you do weaving. Inside, you ask about inside termination, you could have just said, I want to see you again because the level of risk is low here. He did not express any thoughts of harming anyone else. So there's a big possibility that he might be okay in the OPD. Do you have any questions?
No, sir.
What we are going to do now, we're going to do tutoring. So you are going to repeat the station again without any timing. You are going to ask about the complaint in the right way and
Yes,
go through the items of the mental state examination. And from time to time, I'm going to stop you to correct what you are doing. Let's start now. My name is Michael and my brother's name is John. 1, 2, 3, go.
hello, Mr. Michael. I'm Dr. Sharik. I'm one of the psychiatrists working here in the mental health unit. You have been sent to us in the ER regarding an incident that took place in your house. Can you tell me more about it?
Well, I decided today to put an end for what my stepbrother is doing. He keeps taking thoughts of my mind from my mind by his laptop. So I smashed his laptop. And while doing so, I injured my hand.
Okay, since when have you having these thoughts?
Well, these are not thoughts, doctor. These are facts. It all started 3 months ago while I was in one of the exams. I found that all my mind went blank, no thoughts in it. And when I went back home, all the information in my mind was in his laptop, and it happened several times after that. And for 3 months, he kept taking my thoughts and putting them in his laptop.
How did you get to know this fact that your thoughts were in his laptop? How did you get to know that your thoughts were in his laptop?
Because I see them in his laptop. All my ideas are in the laptop. When he opens the laptop, I found all what I'm thinking of in his laptop.
Okay, so what did you do next?
I talked to him and told him to stop, but he didn't. He made fun of what I'm saying, but today I was so pissed off, I decided to put an end because I cannot go to the technical institute. I cannot do anything.
Okay, and do you think that somebody else is also involved in this?
Yes, my stepfather, because he is the one who bought for him this laptop.
Okay, could there be another explanation for this?
No, there is no other explanation, doctor. No other explanation.
You said this problem started 3 months back.
Yes.
Right? Before starting, were there any stresses in your life?
No, there were no stresses.
Or any alcohol or drug use
No.
in your part?
No.
Or perhaps you were started on any new medication or you stopped any medication?
No. Everything was fine before that.
Okay, I can see you're very distressed regarding this. I need you to calm down, and I hope your hand is doing well. Have you got an X-ray done on the hand?
Yes, they took good care of it, and I think it will heal properly. They said that simple injury didn't need any stitches.
Okay. I need to ask you some questions which are a bit strange questions, but these are routine questions that we ask everybody. If you feel uncomfortable at all, do let me know.
Yes, okay.
You were telling me that your brother is taking thoughts away from your head.
Yes, yes.
Have you ever felt that somebody is putting thoughts in your head?
No, no,
Or perhaps what you're thinking inside your head, people are getting to know about it.
no, no, no.
Okay. What about like have you ever thought as if you're hearing sounds or voices that nobody else around you is able to hear?
Yes, sometimes, doctor, I hear my stepbrother and stepfather talking about me while I'm in my bedroom. I can hear them even if they are not present. That's why I'm sure that they are plotting something against me.
Oh, okay. Okay. So how do you think this is possible? Because you are in a separate room from them, and you can hear them.
Maybe the laptop is able to do this.
Okay. So they are talking about you. Are they referring you in person?
No, no, they keep talking about me and commenting on what I'm saying and doing and saying.
Okay. So they comment on your actions, right?
Yes.
Do they also give you commands regarding something you need to do?
No, no, no.
Okay. Any ever had any visuals or images that come to you in which nobody else can see
No,
apart from you?
no, no.
What about any smells or strange taste that nobody
No,
around you is able to perceive?
no, 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 no. Nothing
Okay,
of this
Michael.
sort.
Okay, Michael. What about your mood? How's your mood been in the past couple of weeks?
Okay, stop now. He did not ask about the broadcasting and control
So
over what
I
he do, his moves and his feelings.
okay.
Broadcasting. Continue, please.
Okay. What about mood?
What about what?
What about your mood, sir? Mood.
Please, I want you to ask in depth the
Okay, bro.
psychosis.
Yeah.
Ask about the
Michael,
broadcasting. Yes.
have you ever felt that what you are thinking inside your head is being known to everybody around you?
Maybe by the laptop they can broadcast my thoughts. I don't know, doctor. Maybe everyone knows all my secrets because of this.
Okay. Have you ever felt that you have lost control over your body and somebody else is controlling your body?
No, no, no. Dr. Sharik, use the information which you already have, which is going to help you, and definitely. So tell me, does this laptop also affects the way you move? Can they control your movement by it? Do
Okay.
not be checklisting. Okay,
Yes, sir.
try to put bit of the patient's history or in your question. Go ahead.
Okay. Um, Michael, do you ever feel that your thoughts are being known to everybody around you without you telling them?
No, but maybe the laptop is making them know everything. They can broadcast my thoughts by it.
Is this laptop in any way trying to control your body?
No, no.
Okay. Uh, Coming to a mood, I want to ask you how's your mood been for the past couple of weeks?
My mood was fine. I don't have any problem.
Any problem having enough energy to do day-to-day work?
No, I have a lot of energy, doctor, but I don't know what to do with all my energy while my thoughts are not there.
Okay. Do you feel you're losing interest in your things that you routinely enjoy?
What? What did you say?
Uh, do you feel you're losing interest in things that you routinely enjoy?
Yes, yes, yes.
What about sleep?
My sleep is fine.
Any problem in having food?
No, no, no.
Okay. Have you been getting enough concentration in the work?
What? What did you say?
Are you able to concentrate properly in your work?
No, I cannot concentrate because they are taking all my thoughts, doctor.
Okay. Uh, since you have been under a lot of stress lately, do tell me like how you're coping with it.
I don't know what to do, doctor. I decided to smash his laptop because I don't know what to do, actually.
Okay. So in the process, you harmed yourself. Ever had any thought that you wanted to harm yourself again?
I did not harm myself, doctor. I injured myself while I was smashing his laptop.
Any thought occurred to you that you want to harm yourself?
No, doctor. Now, after smashing his laptop, everything is okay now.
Okay. Have you had any alcohol or any drugs?
No. Again, you are checklisty, doctor. Try to put the stress in and link it to the use of street drugs and alcohol. This will make your question more palatable. We don't want you to have a feedback that you are checklisting. Make it a one-to-one conversation to make it more palatable and more professional. Go ahead, doctor.
So, Michael, apart from this incident, do you think police has been involved in any other past incident?
No.
Okay. Do you think that hello?
Yes.
Hello? Yes. So, Michael, do you think that this is the first time that you've been to a mental health expert?
It's not the think. This is not the thinking. This is a fact. So ask him, is it the first time for you to talk to a psychiatrist?
Yeah. Have you ever been to a psychiatrist before?
No.
Okay. And these problems that you're having with your thoughts, do you think there could be any other explanation to it?
No, doctor, I'm sure that they are taking my thoughts and they are putting it in the laptop.
Perhaps your mind is playing tricks on you?
No.
Is it possible?
No.
Okay. It has been nice talking to you, Michael, and I hope we can help you with your problems. And I would like to see you again for a few more sessions. And thank you so much for coming to see me.
Okay, thank you. Now, I feel now you understand how to do this station better. Now, your role is to do weaving, because in order to avoid the feedback that you are a checklisty doctor and your style of questioning is bad, many of the candidates ask, how can I make a question more professional and it doesn't sound bad? And they think that it is simply literature. They want to pose a question which is literally sound more grammatical and more lingual applicable, lingually better. It's not
that
like
is the problem. I cannot flow in a way.
No, the problem is if you want to make your questions better, simply put a bit of the patient's history in your question. Okay?
Yes, sir.
And this will make the question more palatable and you will avoid the checklist feedback. So I hope that this makes it clear for you. Okay?
Yes, sir.
Do you have any questions?
Like it's a child, so are we supposed to talk to him so formally?
Excuse me?
It's a child we are taking his MSc from. So we have to talk very formally with him, or do we have to...
Doctor, this is not a child. He is in a clinical technical institute, so most probably he is above the age of 1980. So this is not considered to be a child. Okay. Thank you so much, doctor. Thank you so much.